the teaching outcomes for this patient is going to be they will verbalize when to contact their physician considering their heart rate, which is at 50 beats per minute. And then they will also demonstrate correctly how to take their own pulse rate. So, hi, Chandler. My name is Destiny.
Hello.
I'm going to be your nurse today. It looks like we're going to be going over some teaching. Can you first give me your name and date of birth?
My name is Chandler Sainer. I was born December 16th, 1995.
Perfect. That matches correctly with your armband. So it looks like they went ahead and prescribed you a beta blocker. Have you ever taken a beta blocker before?
No, I have not.
Awesome. So a beta blocker is going to work within your heart. It's going to help kind of normalize your rhythm of your heart to make sure that it doesn't go crazy or anything.
Okay.
And so with that medication that you're going to take at home, there's a couple of teaching moments that we need to have you do. And first of all, when you're at home, we want you to go ahead and take your pulse every day.
Okay.
Because what the medication can do is it can lower your heart rate too much.
Mm-hmm.
And so I'm going to go ahead and teach you how to take your pulse. Have you ever taken a pulse before?
I have not.
Awesome. So I'm sure you know that there are a couple places that you can take your pulse. If not, I'll show you. So the first and easiestly accessible is going to be here along your wrist, and this is called your radial artery. Kind of goes with your radius of your bone. And it lines up with your thumb right here. So it's a little bit below, kind of in a cave.
Okay.
So you can feel it right here. Yes, right there.
So I follow my thumb down.
And you're going to just kind of feel inside that there's a little natural groove that you're going to use your two fingers. You're not going to use your thumb.
Okay.
Because you're just going to slightly press lightly, because if you press too hard, you're going to do what we call occlude that artery, and that's going to be kind of close it into where you can't feel the beat anymore.
Okay.
So do you feel it beating underneath your skin?
Yeah.
Perfect. So what you're going to do now is we listen to or feel a pulse for 60 seconds. That is considered the normal range, is in a minute.
Mm-hmm.
And so what we're going to actually do is we're going to listen to it for 30 seconds.
Okay.
And then we're going to multiply it by 2. Okay. Now, if you feel like maybe it's doing something different, maybe it's like not beating at a normal rhythm or the same way, then you can go ahead and listen for a minute or feel for a minute, and then that will be your heart rate also.
Okay.
So for you to know whether your heart rate is normal or not, we have to have a set of values. And we have a set of values that is called your heart rates, or your beats per minute, and it's the normal is 60 to 100.
Okay.
So most people's resting is going to be right around 60 to 70, and then your heart rate's going to get higher, of course, if you're exercising or moving around.
Okay.
So I would recommend that when you do take your heart rate, you try to take it at the same time every day, and that you do it after resting, so that your numbers are within normal, are considered normal. Okay. So we're going to go ahead, and I'm going to take your pulse first, and what I'm going to do is I'm going to use my 2 fingers. I'm going to press lightly until I feel the beads underneath your skin. Perfect. And I'm going to just kind of sit here and count them for 30 seconds. Perfect. Your heart rate right now is 66. So that's a really normal, very nice. And so, of course, you're going to be doing this at home. So I want you to go ahead and try and count your pulse.
Okay. So
Also.
I go down from my thumb and find my radial pulse.
I'm just going to press lightly until you feel it bounding.
Okay.
And you're going to count for 30 seconds and multiply times 2.
64.
Perfect. Awesome. And so, like I said, that normal, your heart rate was normal right now. That normal is going to be 60 to 100. We want you to contact your doctor if it hits 50 beats per minute.
Okay.
Okay, at a resting rate. So after all of this, I know I gave you a lot of information. I want you to just kind of tell it back to me. Kind of explain to me how you would have me take my pulse.
Okay. Well, first, so I'm taking a beta blocker.
Okay.
So for me to assess what the beta blocker is affecting me and how that's affecting me, I'm going to take my pulse. I'm going to go from my thumb down to my radial pulse down around my wrist, taking 2 fingers and in a grooved area, try to find beatings underneath my skin. And I'm not using my thumb because my thumb has an old pulse and it might confuse me. And so I'm going to find it and then count it for 30 seconds and then times that by 2. And then if it's in between the ranges of 60 and 100, it's normal, and I need to notify my physician if it's 50 beats per minute or lower.
Yeah, that's perfect. Awesome. So do you have any questions for me?
I don't believe so.
Okay, well, we'll try to get you out of here as soon as we can, okay? I'm
Awesome.
sure you're